Richard Neff is the CMO of the Indiana Regional Medical Center, and our conversation brought to you by Marcus & Mack, a law firm representing injured people. Dr. Neff jumping on the line with us this morning to tell us about developments with the COVID-19 vaccine. Dr. Neff, good morning.
Good morning, and how are you today?
Wonderful, and it's good to have you with us here today. So an expansion is, I guess, one way to put it. Am I correct in that?
Exactly. We are now able to offer vaccine to everybody who is in the 1A category. That includes people who have various healthcare conditions that are next up for the vaccine, age 16 and above, as well as anybody over 65, and all healthcare workers broadly defined.
All right.
We're excited about being able to offer that.
Absolutely. And other news is that all of the names on the waiting list basically have been contacted, except for those that you haven't been able to get in contact with. Is that a good way to put that?
That's exactly right. And we don't know whether there was a slight error in data input or whether people have gotten vaccine elsewhere. And so if people are on the wait list and have not been contacted, we would ask that they go ahead and give us a call.
All right. So the current wait list, all of those names have been exhausted. So either they didn't get all the information. For a lot of people, their voicemail box is full or it's not set up, and you get that message when you try to call back. Phone number could be incorrect. Whatever it is, if you've not gotten the call yet and you fall in Group 1A, you should give the call right now and get yourself scheduled.
Exactly.
Doctor,
and that number is 724-357-7075, and you go ahead and press option number 8.
Option number 8. Very, very good. In terms of vaccine availability, of course, that is subject to what the state is able to ship to you. Where do we stand on that?
It is still limited, although at this point we do have appointments available.
You do have appointments available, so people can make that call now and they can get on that list. Of course, they can also go online to get it, to get their name in.
Exactly, and the website for that is really easy. It's irmc.org/vaccine.
All right, so we're talking about Phase 1A right now, and there's probably no real way to say when it opens to Group 1B. Is that right?
Not at this point, but the Commonwealth is only getting 2 weeks' worth of notice as far as what their supply is going to be, and I don't believe it's yet going to be in the next 2 weeks. We're hoping that it's going to be not too long, though.
For those who are in Group 1B or even lower groups, should they call now and make their appointment, or should they wait until there's another announcement?
I would encourage them all to go ahead and try and be patient and to go ahead and wait.
Okay.
We only want to have appointments open. I'd really like to get people scheduled when we have vaccine in hand. We could schedule them for June, but I'd really like to get people scheduled earlier. And if we have increased supply, we will have increased vaccination appointments.
There you go.
A little bit of patience will go a very long way.
There you go. So everybody in Group 1A is now eligible. They just need to call and make that appointment. 357-7075, extension 8, correct?
That's correct. Thank you so much.
Dr. Richard Neff, have a great day today. We appreciate it.
You too, sir. Take care.
Bye now.
Bye-bye.
There you go. So if you fall in Group 1A, of the various protocols that are available, you should make your call right now, 724-357-7075. It is extension 8. Extension 8. You'll get the scheduling center. And they will set you up. And they do have appointments available now. So if you are in need of your vaccine, you're in Group 1A, you make that call, and they'll get you on the schedule, and you can begin that process. Okay? Alrighty, it is the voice of Indiana County, WCCS 101.1 FM and AM 1160.